Michigan has changed the way it helps people who are addicted to opioids. We're talking prescription drugs like painkillers as well as heroin. Andrea, could you tell us, it used to be somebody that was on drugs was an addict. I mean, what's changed in recent years?
Two things have changed. First is that the ongoing opioid crisis has really shown how common addiction is in our communities and that it affects people just like you and me. So we're seeing that opioid use disorder isn't a personal failing, rather it's a chronic medical condition and that recovery is possible.
Right, because these drugs I've heard they're actually changing the chemistry of the mind and the way you actually think, and it grabs hold of you and it's hard to shake.
It's extremely hard to shake. Some synthetic opioids are up to 50 to 100 times stronger than heroin, and you're exactly right, it changes the brain chemistry, which is part of why the department is trying to expand access to medication-assisted treatment, which addresses that brain chemistry imbalance.
Okay, let me ask you this though. In recent months, well, actually the past year, there's synthetic opioids, illegal synthetic drugs. Tell us about that.
Yep, these synthetic drugs are much stronger than heroin, very deadly. They're involved in a very substantial share of opioid deaths in our state. So a few important tips to keep in mind are always carry naloxone, which can reverse the effects of an opioid overdose, and never use substances alone if you can help it, so that there's someone there who's able to resuscitate and rescue you if you have an overdose.
Okay, that is fantastic. And of course, the Michigan Department of Health does have an awesome website. We'll have it down below for our viewers to see. Is there anything else on this issue that you think is important for our viewers to know?
It's important to know that the opioid crisis has only intensified during the COVID pandemic, so it's more important than ever to seek help if you need it, to take safety precautions, and please visit michigan.gov/opioids.
Andrea, thank you for being on the front lines. Greatly appreciate it. You're doing such important work. Our next guest is Dr. Dean. Dr. Dean, you're heading up, this is kind of a slightly different angle on this issue. You're heading up this non-drug pain management issue across the state of Michigan. Tell us more about that.
Well, treatment has focused on, there's been a focus on the treatment of addiction. What we want to say is that many people get into addiction by starting out with a pain problem and then try to manage that pain. And if we do not find some way of dealing with the pain that doesn't involve opioids, then we're right back to starting again.
Okay, but tell us, to let our viewers know exactly what is it? I mean, if I'm in pain, chronic pain from a sports injury, I mean, what should I seek out?
Well, first of all, you need to know that there are other ways of dealing with pain than drugs. And those ways include chiropractic, acupuncture, yoga, meditation, massage. That whole area is what we're promoting.
Okay, and again, you're with the Michigan Chiropractors Association. Tell us some of your success stories in this.
Well, for example, I had an individual. He was a teenager. He was a football player. He injured his shoulder. The shoulder was giving him a great deal of pain, and he had surgery. And to recover from the surgery, he was given some very powerful opioid medications. His parents were particularly concerned. Brought the patient to me. We were able to deal with it, and he was able to get out of pain, without using the medication.
Again, not using drugs.
Yes, exactly.
Doctor, thank you so much. I greatly appreciate the work you're doing. And we'll have on the website below, you can find out more about non-drug pain management. All right, that's all we have time for today. If you are using or you know somebody that is using, get help at this website below. Let's take care of one another. From the capital city of Michigan, I'm Joe Ross for CR News.